Emergency contraceptive pills, or in short ECPs, are medications used in case of unprotected sex or contraceptive failure such as a broken condom, or in case of missed regular birth control pills. Means to prevent unwanted pregnancy, these kinds of pills are used. So these are nothing but emergency contraceptive pills. These pills should not be used as a regular method of contraception. Okay, means these pills are used as a backup contraception method or backup contraception plan. Okay. Anyway, in India you can see that I pills are available, then Unwanted 72, these pills are available. Actually there are more pills available in India, but I am talking about in this video only about I pill and Unwanted 72. Both are emergency contraceptive pills, and both of these should be taken within 72 hours after unprotected sex, and these pills should be taken as soon as possible. Means these pills should be ingested as soon as possible. Then you will get much more efficacy. And one more thing, these pills are not 100% effective. Success rate for such pills are almost 89%, up to 90%. But not 100%, it is always less than 100%. How these medications work? Just by delaying the ovulation or preventing the ovulation, or by altering the cervical mucus. Means in case of change in the cervical mucus, then in that case sperm cannot reach to the egg. So this way fertilization is prevented. Again, if fertilization has already occurred, in that case implanting that fertilized egg in the uterus lining is prevented. This way, by taking these pills. There are actually two main types of pills available. One is a Levonorgestrel based type, Levonorgestrel, and another one is Ulipristal type, Ulipristal acetate. Okay. So here I am talking about only I pill and Unwanted 72. Both belong to the category of Levonorgestrel based type medication. Okay, Levonorgestrel, this is what? This is nothing but a kind of synthetic progesterone hormone. Anyway, how this works? This may prevent or delay the ovulation, or this may alter the cervical mucus. So this is the mechanism of such medications. And both are type, I have already mentioned the type, Levonorgestrel type, Levonorgestrel based medication. I was talking about only I pill and Unwanted 72, not all types of pills, okay? Ulipristal type, Ulipristal acetate type medications are also available. Anyway, side effects are there if you use such pills. So frequent use are not allowed. Yes, if you use frequently, then there is no problem with the fertility. Fertility won't get affected. But side effects are there, such as nausea and vomiting, abdominal pain or cramps, change in menstrual cycle like earlier or later, or heavy periods. Okay, dizziness. So many types of problems are there. Means if women use such pills in case of emergencies, then they may suffer from such problems. So the main thing what I want to share with you is that if you face any problem after taking such pills, then in that case you must you must consult with a healthcare provider. Don't take your own decision. Okay? Side effects are there. Maybe in your case, it is more than the side effect. Okay? Anyway, these are safe to use, and in many places, I am not talking about only India, in many places these are available, these types of medications are available over the counter, and in some places prescription is required. It depends upon the region, but the main thing is that these pills should not be used every now and then. These pills should not be used as a regular method of preventing unwanted pregnancy. Okay, only in case of emergency, these pills should be used. Anyway, so this was all about I pill and unwanted 72. And so this is the end of this video, end of this lecture. Thank you for watching this video.